Healthcare systems are at the front line of delivering critical care during emergencies, and that's true for the regular flu season, but also for more extreme events like cholera outbreaks during flooding, earthquakes, hurricanes, and of course, pandemics. Especially in developing countries, though, healthcare systems are under increasing pressure because of disaster risks, but also the effects of climate change and zoonotic diseases, and of course, constrained resources and capacity. When health systems get overwhelmed during emergencies, it can slow down the response and aggravate the crisis, but it can also disrupt essential healthcare delivery like maternal and child health. So to deliver universal health coverage in the face of such pressures, our new frontline report shows that countries need to take urgent actions to strengthen the resilience of healthcare systems. That means enabling health systems to maintain their core functions throughout a crisis, but also to actively support disaster response. And in this report, we focus on the intersection points between healthcare systems, disaster risk management, and quality infrastructure. We emphasize that health systems are not isolated, but they are embedded in a wider network of emergency response systems. And the challenge, however, is that in developing countries, even before the pandemic, many health systems were already struggling to meet routine demands. And in the coming years, the pressures on these systems are only going to increase. So in this report, to prepare health systems and to increase their resilience, we offer 5 crucial areas for action.
The first is the foundation, which is having an inclusive and equitable health system that can deal and manage the routine demand for health services in a country. Then we start with individual healthcare facilities, which is your hospitals and community healthcare facilities. These units have to understand their demand for routine and surge and during pandemics and disaster to be able to prepare and respond effectively and efficiently. No healthcare facilities operates in isolation, and we have to look into healthcare capacity as a connected system that coordinate and cooperate with each other. And of course, healthcare system has to communicate and coordinate with wider disaster risk management system in a country for an integrated and successful preparedness and response to disasters. And of course, no healthcare facility can provide adequate and quality service without access to water, transport, telecommunication, and infrastructure. So we have to ensure the resiliency of these lifelines to be able to build the resilient health system.
So check out the report for very concrete recommendations and priority actions in each of these areas. And of course, this is more than a report, and the World Bank teams now will be working with countries to prioritize and identify implementation actions. So thanks very much for your attention.